Hello, how are you? Good morning, good afternoon, wherever you may find yourself. Here, Dr. Doki talking to you about diabetes once more again. And I have quite a lot to talk to you about diabetes. And good news to all of you, my listeners, and who have been following me, that now the book I have been talking about, the dietary management of diabetes, is finally out. And this is the hard copy. This is the hard copy of dietary management of diabetes. And this book is now available in hard copy and also in electronic copy. And it's gonna be on Amazon very soon. It's gonna be on Amazon very soon, and you can be able to purchase your electronic copy from there. But if you need a hard copy, you can easily get in touch with me. Whether you are in Kenya, any part of Kenya, you can get this book, because I'll only go to the matatus and the buses that come to your place, and I'll be able to give you this book, to give them, and they'll be able to deliver this book to you very safely. It's only 1,500. This book is only 1,500 hard copy, and you can get it anytime. So when you have purchased 1,500, then we'll only be able to consider the transport from Nairobi to wherever you are. And even if you are in East Africa, you may be in Uganda, you may be in Tanzania, you may be in any country in East Africa or Africa, we can organize how you can get a copy of this book, which will help you a lot, quite a lot. This is like when you have it, it will direct you on what type of foods you want to eat as a diabetic, so that it doesn't raise the glucose concentration in your blood. Safe foods. And if you've been following me, I've been talking about this quite a lot. And this book is the answer. It has got all the books you need for breakfast as a diabetes that will not be able to raise your sugar. It tells you what type of food you want to eat at lunch time, and also it tells you what type of foods you'll be eating as supper or dinner. And even when you have gone outside with friends to celebrate, it will tell you what type of foods you can avoid and those that you can be able to eat very, very safely. So this is the book. If you just check inside, of course you have the introduction, and then we have chapter 1, which starts with understanding diabetes. You need to understand scientifically what diabetes is all about, how it is caused, how it is diagnosed, and how it is managed, and all those kind of things. And then the second chapter deals with the importance of dietary management. So we introduce diet, we introduce type of foods that are safe for you as a diabetic. And then we have chapter 3 goes on to say about nutrients for diabetes, so that you can eat good food, but at the same time you control your blood glucose. Very important. Monitoring and managing diabetes, very important. Monitoring and managing your blood sugar, very, very important, very important. And I'm going to show you later on how you do that even when you are traveling. And then we have another topic in there, topic number 5, which are tips for everyday living as a diabetic. And then we have the delicious and nutrients which are good for you as a diabetes. And then we have normal diets. We discuss normal diets, and we discuss many more other foodstuffs in here that you need to have. So you need this book with you, that when you want to make let's say breakfast or lunch or supper or snacks at 10 or snacks at 4, This book has got all that, and it will explain everything to you. Imagine, it's like you have a teacher with you when you have this book. So please get this book. We are going to give you the my telephone number, the contacts. You can be able to contact me, and you can be able to order, and my number, which is an M-Pesa number that you can easily send the M-Pesa in there. And once it comes my way, I guarantee you, I will personally ensure that this book gets into your hands as soon as possible. So here we are. Somebody said information is power. And I know that when you went to the doctors and you were diagnosed with diabetes, they gave you medication and you are using medicine. Now, when you follow this book very clearly, maybe the doctor may have indicated for you to use maybe 3 tablets per day or 2 tablets per day, 1 in the morning, 1 at lunchtime, and another one in the evening. When you follow the diet that is indicated in this book, you will discover that this diet will be reducing your sugar concentration every now and then. And therefore, the more it is reduced, coming down the sugar concentration, the less drugs you'll be using, the less medicine you'll be using. And you find that maybe you've been using 3, now you're using only 2. 1 in the morning and 1 in the evening. And later on, it may reduce to the fact that you can use half tablet in the morning and half tablet in the evening, depending on how you are going to use this book. Very good. It has got also exercises and fasting exercises to lose weight. Those who are diabetes or those who are not diabetic but they want to use to lose weight, this book will tell you how to do that. We call it fasting that is determined in a very good way, so that you can be able to lose weight. Because the moment you are diabetic and you put on weight, you are endangering your life. Because what will happen is that high blood pressure will set in, and high blood pressure is not good with diabetes. Not good at all. There are 2 enemies. So you rather get rid of high blood pressure and remain with diabetes, which you're going to control. And that has happened to many people, and it is possible. So how to lose weight, how to even come to reverse the diabetes in your life. This is the book. Get in touch with me. And it's wonderful that I have introduced this book to you. And we have been working on it for years now and months, but now finally it is out, and we thank God for it. So there you are. You have your information. You are responsible. You can do what you want to do, and there you are. You can have this book in your hands, and you have power and information with you to control your diabetes and to live a normal life. The aim is to make you live a normal human life. The way you would have lived your life, here you are. And it will explain to you everything. Thank you so much for listening to me. And may the Lord God bless you always. Thank you.